Hello and welcome to the Northumbria Way podcast. My name is Emily Lavin. I'm Marketing and Communications Officer at Northumbria Healthcare and I'm delighted to be your podcast host for today's episode. Wednesday the 19th of June marks National Estates and Facilities Day. The day was created to celebrate the achievements of staff working in estates and facilities and to recognise the importance of these services in the delivery of care to patients. Often referred to as the unsung heroes of the NHS, we have a fantastic estates and facilities team who work tirelessly to keep our trust up and running every day. Today I'm joined by 5 members of staff who work in estates and facilities across our trust, and we're going to chat about the importance of these teams, the impact they have on patient care and how they go the extra mile to improve patient and staff experience. Welcome to the podcast, everyone. I just thought we would start things off by introducing ourselves and giving a brief introduction to our role.
I'm Jackie Brown. I'm Domestic Superintendent at North Tyneside General Hospital.
I'm Janet Scott and I'm a domestic at North Tyneside General Hospital.
I'm Karen Horan, I'm the head porter at Cramlington Hospital.
I'm Gary Talbot, I'm an estates officer at Wansbeck General Hospital.
I'm Katie Wright, I'm a catering superintendent at NSEC Hospital.
Fab. So a really good variety of people working in estates and facilities. So I want to just start off by asking you all how you got into your role within NHFM and sort of how long you've worked here. So Jackie, do you want to go first?
I just had my son. My family worked at Preston Hospital and the hours were suitable. My husband come in from work and I did like the tea time shift. So that's how I started, just until he went to school and he's 33.
Well, it was actually my sister in Scotland was a domestic, and for quite a few years she kept saying, you would love it, you need to start getting into that. So I applied, and again it was the hours suited with the kids at school because my husband works away, so I had to be there when they're on holiday, and so the hours were perfect for me, and I just went for the interview and got the job, and it was great.
So I've only been with the trust for 3 years. I literally saw a job on Indeed. No, I'd literally just not long left the army, didn't know what I would do. So a position come up for a charge hand porter, and I thought that's something that I thought I'd find quite rewarding and something different from what I was previously doing for in the service. So I applied for that, and I think after a year, was it a year? I think I then took the position of a head porter.
Can I just ask, what did you do in the army?
So I was a logistics specialist, so I worked for the Royal Logistic Corps. Originally, obviously, it was something different coming into the NHS from a service background, so I just thought it was something, and obviously COVID was happening at the time as well. So I think that made me feel like wanting to do something different and do something good for, you know, the public. So it's a massive change, obviously, due to the military background to working for the NHS, but it was just something at the time I thought, this is something I want to do and give something back, really. So so it is a lot different, and I'm still trying to adjust to some of that. But yeah, it's rewarding, so I enjoy it. I'm pleased with it.
Oh, it's a brilliant story. What about you, Gary?
So I started with the NHS back in 2007 and I got an apprenticeship at St Nick's Hospital as an electrician. Studied that and then started back with the trust, or NHFM, when it just sort of first started out. So I started with NHFM in 2014, so nearly 10 years now. Coming up in September, it'll be 10 years. I came as an electrician or a multi-skilled craftsman, and then I've just sort of progressed my way up into like supervisor position. Now I'm an estates officer, looking after like the whole, like an estates team on a site.
And I guess you're sort of like an example of someone coming in as an apprentice, what they can achieve throughout the years. So yeah. It's really good. Katie?
So I started fresh out of school. I lived in Hexham at the time, so my mum, my grandma, my auntie, my cousins all worked at Hexham Hospital. So I originally started as a catering assistant just on the bank, just for a bit of pocket money really. And then seeing a different side to catering, like patient care, because when you think about catering, you just think about hospitality, silver service, hotels. I didn't quite realise like catering had such a big positive impact on patients. And I realised, actually, I want to stay here. This is what I want to do. So 2007, I started and progressed. And now I'm a catering manager at NSEC. So don't know how many years later that is. Not the best at maths, but still here. Absolutely love it. So
I guess on that, obviously you'd mentioned about the impact it's having on patients. So what sort of impact do you think your role has on patient care?
Oh, we're a massive part of a patient's recovery. I don't think people realise you've got people, so many different special diets, people that come in with, you know, swallowing issues or they've had major stomach surgery, and sitting with a patient and telling them what they can have and what's available for them is a big part of their recovery. So you come away feeling like you've achieved something, you've helped someone, and I would like to know that that's how my family's being treated. So that's the most rewarding part of this role, definitely.
I think a lot of people wouldn't think about that. They just think, oh, it's just serving food and that's it. But no, it's not. There's so much that goes into it.
So when I left school and seen a position for a catering assistant, I thought, what you learn, I did catering and hospitality at school. So you think about silver service, serving people. You don't think about sitting at someone's bedside and being a big part of their recovery. That's what made us realise I wanted to stay in the trust and do this job.
And Gary, what do you think? How do you think your role impacts on patient care?
I think obviously the estate that people have that care given to them in is an essential part of like the journey. So like we have to maintain that in a state which is safe for them to be in, and a lot of things go on behind the scenes that people don't really realise are there, like to make sure that the areas are well ventilated, have power that is not going to go off, etc. So it takes a lot of maintaining in the background things that people don't even realise are there, but we have to sort of upkeep those things to make sure that it's a safe environment for the patient care to take place in.
Yeah, it's not just about making stuff look pretty and like nice to look at. It's more about
There's the bits that you see that are like painting and decorating and fixing the doors that you actually see that are damaged and things like that. But there's a lot of stuff up in the plant rooms and on energy centres and things like that that people wouldn't even imagine are there.
And Karen, I guess in your role, you're responsible for safety of patients as well and moving patients around the hospital. So how do you think your role impacts on patient care?
Well, I think we obviously all bring something, but I think portering, I think it's always one of the, obviously normally a porter is the first person the patient would probably come to, you know, whether they just be walking through the door and we're showing them where to go, and whether we're getting them a wheelchair to take them to the ward or location they're going to. But yeah, it's just the porter making feel like if they were moving the patient around, whether it be from A&E to a ward or from a ward to another ward, it's just making that patient feel comfortable. And, you know, porters are quite good at talking to them, making them feel at ease, you know, whether it's even taking them to an x-ray or something. It's just having that good communication with them and making that patient feel at ease.
No, definitely. I know from my experience here, I've heard about porters sort of going above and beyond for patients. Like I've heard about one who went to loads of shops to get a can of lemonade just because it was an end-of-life patient and that's what they fancied. So I think it's good to see that they are involved in that patient care and they do have a personal connection with the patient as well. What about you both in domestics?
On the wards, I think a lot of the patients feel comfortable, like Karen says, because the domestics are quite grounded, whereas the nursing staff seem that little bit more professional, giving the care, whereas when the domestics in, it's your day-to-day chatter with them, how you doing, you know, and they talk about their family, their kids and everything, while you're in the room cleaning, you know, so that like having like that little bit one-to-one chatter, not about that illness as such, it's to take them away from that a little bit. That's the feedback we've sort of getting on that.
No, that's really interesting. Do you feel the same as well?
Similar to the porters, we're normally the first people they see when they come into hospital, we're their face, so it's nice to be, and a lot of them are quite stressed when they come in, or they can't find where they're going to go, so it's nice to help them. And sometimes if you take them to where they need to be, they're grateful and it relaxes them a little bit and they're not quite as stressed. It's nice for them to see a friendly face when they come in, and I think it's quite important that it gives a good impression of the hospital that we're there to help.
On that, I was just going to ask, has anyone had a moment in their career where they felt really proud of something that they've done for a patient?
Oh, just going back to when I first started, I did some like allergen training, and some food safety awareness. And we had a patient on ward 4 at Hexham. When I was sitting by the bedside, it wasn't normal practice for us to sit and do the meal plan with the patient. The dietitian would go and speak to the patient, see what their needs were and feed back to the kitchen. We would look on the menu and see what we could provide. Why can't I go up and speak to the patient and sit with the patient and do a meal plan? Because I'd like to think someone would do that for my family member, make them feel comfortable, ask them what they had at home, and sit and ask that. Stayed after my shift actually, did a meal plan for that patient, laminated it, took it up so the family could come in and see it. And I got like, not rewarded, but thanked for it. And I went home thinking, I'm so pleased I did that.
Were the family quite appreciative of it?
Yeah, it was them that thanked us, that actually, that asked the ward staff to come down and thank us. And we do that every day now, believe it or not. So now that's come into normal practice, that we would go up on the wards and speak to the patients and be a big part of the patient journey.
So you do get involved with like the patient care, like you do have one-to-one interactions with the patient?
We work really closely with the dietitians as well, so we have regular meetings with them, and they're always like thanking us for, you know, going up, being present, being on the ward, speaking to the patients, obviously taking advice from them. But yeah, it just makes it, like I say, totally different. You never think about catering assistants having to do this, or catering staff.
It's a bit of a minefield, catering now, with all the different allergens and everything like that.
Well, we're responsible for the safety of patients, you know, delivering the correct food for them, and bound by like Natasha's law and things like that. So it, you know, it is a big world, and like I say, a big part of their recovery. So, but it's good, it's nice to go and sit with a patient, and, you know, you feel like you're part of the ward team as well. So, but yeah.
Brilliant. Has anybody else got a highlight moment in their career on patient care?
A number of times, patients, more the elderly patients, believe they have to pay for the food in the hospital. And a lot of them's come in, you know, with no purse or anything, so they're frantic, and they only felt comfortable speaking to the domestic about it, and to sit down and explain, you don't actually pay, it's free, you've paid for it when you were at work, and you know, you can eat and be nourished, and put them in mind, but that happens quite regular with the elderly patients.
And I guess on that, it comes back to like the friendly face thing as well, that people feel comfortable to be able to say that to you and to open up.
Because it's the same people sort of, you know, on the same wards with the same patients, and you get to know them really well.
So moving on to challenges, are there any challenges in your role that you think go unnoticed by the public quite a lot?
I would say definitely security. I think they go unnoticed in terms of patient safety. I think people don't realise, especially the public, the impact security have on patient safety within the hospital, staff safety as well. You know, some of the situations the security officers are in is very difficult, and they're a massive part of ensuring the patients are safe, the staff safe, and themselves as well. So that definitely goes unnoticed. They're not just here to look after the car parks.
Yeah, I think that comes in everybody's role. You know, like Gary says, just heating the hospital, how does the heat get there? You know, you just expect it to linen, nurses pulling linen out of a cupboard. Who puts the linen there? Where does the linen come from? There's a lot of hidden challenges that people, it just happens until it doesn't, till something goes wrong and it stops, and it's, oh, well, what happens now? You know, and we're scurrying around in the background, putting it right and ordering more linen in, or getting the heating up and working in the middle of winter and things like that.
I think it's like, because people think this is like an add-on service, don't they? Then it's not like a core patient care, but it actually is, and you do a lot to keep this hospital up and running.
I mean, there's times like you say, unnoticed in the background, you know, like with winter pressures and that especially kicking in, there's a lot of times, sometimes we could be running low of oxygen and things like that. So again, it's porters getting in touch with BOC and saying we need, you know, more oxygen and that, and it just seems like everyone automatically thinks it'll be there, but obviously we're managing the oxygen levels and everything else, so it's down to the porters to make sure that the stock levels are there for winter pressures and stuff. So I'd say that goes unnoticed because they automatically just say, can we have some oxygen? The porter will go and take it, that's fine, but who's actually managing the oxygen levels? And again, that's down to us. So I'd say that's one of the main, especially winter pressures that we have.
That's like the public not realising that we're not frontline staff though, isn't it? Because you think of your medical professionals, I think estates and facilities aren't noticed as key part of the patient experience recovery. Like we're working behind the scenes, but we are like, you know, working with the frontline staff.
Yeah, absolutely.
And obviously oxygen's a major thing, isn't it, for patients and when they come in, and like going back to the patients having major stomach surgery, the biggest part of their recovery is the food.
Yeah.
So we provide the food, so it all intertwines, doesn't it?
And drivers also go unnoticed. They do a lot in the background. They're back and forth from Cramlington Hospital to North Tyneside, up to Warnsbeck, back, pretty much doing that full circle loop, carrying blood, anything to pharmaceuticals, the drugs for the patients. So I'd definitely say they go unnoticed.
Okay, so my next point is morale. How do you keep morale high within your teams? Because I know, obviously, estates and facilities can get very stressful at times.
Good communication, great communication with the teams. Keeping them up to date with everything, supporting them through change, especially the run up to Christmas dinner week. Ensuring that everyone's, you know, in the nice Christmas spirit and just working well as a team, supporting each other. You know, that's mainly how we keep the morale high.
You said supporting with change, so what kind of changes happen within?
Well, obviously within like catering, there's, you know, we change the patient's menu twice a year. So because we work from a plated meal system within the trust, and we have new staff coming, it's ensuring if we change the equipment. So trust-wide, we've all gone to the same plated meal system now, and you get new equipment, so it's all new training. And obviously staff that have been there a lot of years and done the same thing, when change comes in and doing something different, it's difficult for some people, so you've got to make sure you're there to support them. The way that patients order their meals, you know, like within time, when I first started, it was patient line. You know, they don't even exist anymore, so it's supporting the staff on the wards as well. So, because the ward staff are responsible for ordering the patients' meals. So it's us going up and supporting the ward staff and working together with them as well as our catering team to ensure that they know what they're doing. Because obviously it's important that the patients get that choice.
So is it like the development of technology and stuff like that?
Yeah,
so
absolutely. Moving with the times. Yeah. Going away from pen and paper.
We've even got a robot now.
Oh, yeah.
Yeah, we've got a robot now as well. And the machines, like the T3s and the T2s, it's helped us in our work. Obviously, before it was mopping, manual and quite hard, but there's a lot of that modern technologies. And now we've got a robot that goes by itself.
How was the robot? Like, how do people find that?
It's strange, usually. Usually they think if one of us is behind it, they think we are operating it. And then when we kind of stay still and it keeps going, they can't quite figure out why it's going on its own. So we've had a lot of fun with it, watching it and stuff, and watching people's faces. But it's took a bit of getting used to the robot, I have to say. And you hear it coming, and you start kind of panicking a little bit. You think, oh, but it's been good. It's been good.
How
yeah.
have patients taken to the robot if they've seen it?
Pretty much the same, kind of, you know. How's that happening? How's it going? They kind of quite, and then we explain to them that there's things on the wall it follows, and it's all coded and things.
Karen, I know you've only been here for 3 years, did you say? But what changes have you noticed within your time here?
I mean, I don't know if it's really valid, but I would say when I first came, the hospital hasn't expanded as much, but they have put more wards or areas on there. So on the top corridor, there was a lot of open space, and they've actually made that into another 3 rooms, sort of different. Like, we've got now a procedures unit. The discharge lounge has been slightly expanded to more having beds, and then we've got PAU up there now. So if anything, it just seems to be growing more. Even though they haven't physically built anything, they've managed to use space and put more on there.
So I just want to finish it off because sort of estates and facilities teams are sort of looked as in the background of what goes on in the hospital. So I just want to ask why you all think it's important to celebrate Estates and Facilities Day.
I think a lot of young ones coming through with the sort of social media and the TV aspect, they all want to live this lovely, glorious lifestyle. I've had a fantastic life in the NHS. I've been all over the world on my wages from a domestic. It's how you manage your time. It's the people you meet on the journey. That's the most important thing. You finish your shift at the end of the day and think, yeah, I've really helped somebody today.
I think from like an estate's perspective, there's a lot of people who don't realise like how long hours some of our guys work. Sometimes they've got to get out of bed in the middle of the night just to respond to an emergency. And that's obviously quite disruptive on their sleeping pattern, and they've then got to have some rest the next day. So that's like a big contribution that they make to be able to support like such a complex operation. So I think that's got to be celebrated.
I think we need to celebrate it as well, to talk about it, because not everyone knows what is estates and facilities in a hospital. So it's, you know, telling everyone, these are our jobs, this is what we do, this is how important they are to the trust. And like I said before, we're the unsung heroes, so we should be shouting about it and celebrating it.
I do think that the whole estates and facility sides, it definitely works as a good team. So no matter what department you work for, you definitely bring in something, and that's either patient care to the cleanliness to the feeding, making sure the patients are transferred, you know, feeling comfortable and happy, well, as happy as they can be, and make them feel relaxed. And then you've got the estate side that literally, as Gary said, you know, just make sure the maintenance and everything else is gone. So, but what my main point is, we do all work as a team, and there's no way that you know, you could feel like you're here on your own. If there's something they're not aware of, you know, you could go to Kate and say, actually, you know, what about this? Or everyone just brings a bit of something, and we're definitely a good team together.
So I know you all work in different teams, but are you all quite closely connected?
Oh, definitely. Yeah, definitely. Yeah. If there's a problem, like estates, I could go to any of the estates fellas and say to them, right, something's broke, what can I do, or who do I go to? I've never had a problem, even the catering. If there's something with the catering that maybe there's a special occasion and we go to them and say, somebody's birthday, could we have such and such? There's never a problem. The porters are fantastic as well. They're always willing to help you. We all kind of help each other, to be fair, and support each other. There's a great friendship, I think, even though we're different departments. We all kind of recognise that we're kind of all doing the same job and we're all there for the same purpose. So it's great, it's good.
Works across sites as well, though. Like, I wouldn't think nothing of ringing Jackie down at North Tyneside and saying, can you help with this issue, or just can I pick your brains about this? And, you know, I think that's massive that we can go to each other, not in different departments on the same site, but across different sites as well.
So why do you think it's important, Jackie, to celebrate Estates and Facilities Day?
I think everybody's role within the trust's important, but when we had our last Estates and Facilities Day, the private messages that were wrote on the cards from physiotherapists to doctors and everything, their messages were really heartfelt. They were amazing, and I couldn't shout about them enough to, you know, like my team, the domestic team, but it was right across the board for everything, and they all had something lovely to say about every single, you know, catering, portering, estates and security. The whole thing, they were great.
So it's good to see you've got the support from wider trust staff, not just the support of your NHFM colleagues.
It was really eye-opening, because you see them day to day and hello and, you know, how you doing, but to actually read those cards, Rosie, you'll remember the cards, the messages that were on them were absolutely lovely. I think you posted some of them actually. And I think that was really, really nice.
Well, thank you everyone, and I hope you all have a lovely day celebrating National Estates and Facilities Day.
Thank you.
Thank you.
Thank you very much.